Hello, my name's Anthony Weller. I'm the Department Head of General Practice here at Attune Health Centres. So thank you for watching this. What I want to explain today is what the General Practice Department is like at Attune, how we function, and what our points of difference are compared to a typical general practice. So the basic question, what do we do? We're a very typical general practice in terms of the load that we deal. The very typical kids, acute illnesses, musculoskeletal, wound care, health checks, immunisations, very typical scope of general practice. We also do residential aged care facility servicing. So I service a local residential aged care facility in the area, and the department, that's something that will be within our scope. The main thing to point out is that our points of differences are really key, and the focus is on chronic disease management, especially in conditions that are served by a multidisciplinary approach. That's the premise of the setup of Attune, is that we've got all those wonderful different health professionals that we can tap into as a resource, work together, communicate well, educate each other, educate the client. And the complex chronic disease is an area that brings that to the forte very succinctly and nicely. We deal with simpler medicine as well, but that's a real forte serviced by this model. So things like chronic pain, mental health conditions, complex GIT issues, and that non-specific presentation, fatigue, autoimmune, make up a reasonable or a significant proportion of the clients that are seeking an interaction with Attune. What you'll notice is that they'll often be seeking an interaction not just with the health professional, the general practice department, or the osteopathy department, but there'll be a number of people that will be very interested in that collaborative approach between multiple departments. I've been seeing somebody already here and I'm interested in another service. I've been seeing the GP, can I also work with the dietitian? I've been seeing the osteopathy, and now I'd like to look to the general practice department, bringing that together. Now, people are independent practitioners, and there might be times where we use people outside of that model, but there are also going to be great times for collaboration within the Attune Health model, and that's been very deliberately and purposefully set up to facilitate that. We're also focusing on lifestyle-based and non-pharmacological methods, as well as accepted medical practice. So something that you'll hear more and more of is that lifestyle-based prescription. From a general practice department point of view, I find that especially in a busy GP model, we're often defaulting to paying lip service to a lifestyle-based prescription. So when we slow things down and really focus on it, how are people actually eating, rather than just saying, is your diet good or poor? How are they sleeping? What is their exercise program? What should we be aiming for? And rather than just quickly noting that down, developing targeted plans around those specific areas. Obviously, when the simple things are done well, it makes a huge difference. But they're often overlooked as we're trying to explore, a lot more technical and pharmacological based processes. But that foundation we need to keep on going back to. We have a practice nurse on board that can help with chronic disease management, and that's been developing more and more. We're able to provide some skin and other surgical procedures such as wound repairs as well. Another point of difference in Attune Health Centres is our ability to communicate face-to-face across disciplines behind the scenes. So there are more than 10 other allied health disciplines that are represented within Attune, and I have the opportunity to interact with them in multiple ways, and we're developing more models to facilitate even better collaboration. So whether that's talking to an osteopath behind the scene, asking a naturopathic question to one of our naturopaths that are on site, we want to formalise this model a bit more in something called a joint consultation, where there is a deliberate consult set up, where there is a multidisciplinary approach think of it like a multidisciplinary team meeting that takes place in a hospital, and we often see this in rehabilitation, in cancer therapy, where there's physiotherapy on site, there's rehabilitation focus, there's a social worker or psychological support on site. That model with some planning and some determination and pre-purposing can be delivered at a primary point of care, and we are a model that can facilitate that. So keep your eye out and feel free to ask more questions about that if you have any questions about it. So this is going to really help us in terms of that interaction of, number one, learning each other's scopes, learning, which physio has a particular interest in this, which GP has a particular interest in that, which will better help our referral process. It'll better help us serve our clients moving forward as well. And it'll also help us with education behind the scenes with each other as well. If I know that there's a physio with a particular interest in shoulders, what can I learn from that particular person's experiences over time? If somebody's great at gait assessments, as their specialist area, if somebody's got a particular interest in dry needling or acupuncture, those sorts of things we can do more. With the client's permission, we can share information on a client's progress, and I've utilised that model on numerous times with the patient consent, and I just find that ease of communication of that so valuable that there's less disjointment. It just seems like a smoother flowing process because I know what's happened in the last physiotherapy session, I know what's happened in the last psychology session, because the patient's given us permission to talk behind the scenes. But that helps me in my next session with the client. I think the clients are really appreciating that communication process. I think they feel the ease of that communication sharing. As a department, I think that's something that's really good. I think across Attune, I think it's something that's fantastic. We're committed to good communication and thorough medicine, and in order to achieve this, we dedicate longer appointment times to our clients. And so, again, we are a mixed billing model, so it's not a bulk billing model going through, and in order to be a business sustaining model, I think that's important. But the focus is on spending that additional time with each client, again, so that we can go through the basics really well. What is that lifestyle prescription? What is that complex condition, and how do we approach it in a thorough and methodical manner? Who else do we need to get involved, and can we do that within Attune? Do we need to get outside help? But putting those pieces together in a methodical and thorough manner, and again, I think the clients would really appreciate that, and then taking the time to explain things well, communicate well, come up with a shared plan together moving forward. We also try and help our clients that can't make a usual 9 to 5 appointment, and so our department will tend to offer appointments a number of days a week that will go later on into the evening, and also alternate Saturday mornings at the moment. We have a large number of allied health professionals, so a lot of the things like the physio, osteopathy, psychology, dietitian, absolutely on site, but hydrotherapy, the dietitian Alison at the moment here, I can utilise for a residential aged care facility dietitian review, which I found particularly valuable. There's breathing therapy on site with DNO Raw. There's naturopathy on site. I'm finding everybody very professional, and their opinions they're very keen to share. I'm finding the cross-educational experiences really valuable to my day-to-day practice. The interactions across allied health, the important thing to remember is that we are very much an integrated and interdisciplinary clinic, but those processes are still the formal processes. I send a referral to the physio. I don't just tap them on the shoulder and let them know. I send a referral, a mental health care plan, if indicated, to the psychologist. Now, by all means, with the client's permission, if we can talk to the allied health professional about what our thought processes are, what our provisional diagnosis, and seeing what they think of the initial plan, absolutely fine, that's wonderful. But that official formal communication, so that's again usually a printed referral, an emailed referral, that goes backwards and forwards and included in the patient's notes as well. We do a lot of behind the scenes catch up, so the GP equivalent of what we call corridor teaching. That's been very much taking place, and I love the fact that that's taking place not just within a department but interdepartmental as well. And I'm absolutely for that, and long may that continue. I think formalisation of that process is something that we will be continuing to develop as well. So some of the ideas floating around this is if we take a certain gait condition or a foot problem, what is the podiatrist's role in treating that condition? What is the dietitian's role in promoting, good nutritional health to help treat that potential condition? Is it a B12 deficiency, all that sort of thing? What's the GP's role to do that? And so, looking at a common condition, but I think that would highlight very quickly, number one, that we all have our slightly different scope of practice, and we look at the same core issue from different points of view. But there's so much that we can learn. Can I integrate a small part of the osteopathic assessment into my gait assessment? Absolutely, from that side. Can I, I'm not a naturopath, but can I get a better understanding of that complementary program so that it can help me in my practice more? Can I get a better understanding of the dietitian's programs and things that I need to look out for in that? There's real scope to continue to learn and develop, not just within your department, but across departments as well. So another important thing to remember is that this is not an alternate medicine clinic, and I'm not an alternate medical practitioner. I've been trained in a traditional model as a GP, both from a medical school point of view, from a GP program point of view, the Royal Australian College of GP or FACA or equivalent. What I do really want to emphasise though is that there's a lot of people taking complementary medicines, and I need to be aware of this in order to guide the way that I prescribe, especially from an interactions point of view, and again from a communication point of view. I want a client to be comfortable to tell me what complementary medicines they are taking, because they are taking them, and that way I can then work with them in terms of what I'm prescribing and keeping a track of that well. I think that that's very important from a professional point of view and from a medico-legal point of view as well. So from that point of view then, I'm not a naturopath, I'm not an alternate medical practitioner, but I am an integrated GP, I am an interdisciplinary GP, because that's the model that is facilitated by Attune Health Centres. We do work together, formally, we work together behind the scenes. We learn from each other's different scopes of practice to provide a more complete, a more thorough, and a well communicated and a well educated program. And I tend to find that I'm learning a lot from that process, as well as the clients are getting a better, more thorough level of care as a result. So we've got naturopathy on site, we've got breathing therapy on site, and I find that these are, a lot of people have got a psychologist on site, they've got a physio on site. We have expanded that scope of services that we offer within Attune Health Centres, and I'm finding that this is a very professional and a very useful way of being able to help our clients. A lot of clients are coming in with questions around complementary therapies, and I'm not somebody who's been specifically trained in these areas. So to be able to gain insights from people who are specifically trained in these areas, I find particularly valuable, and as a general practice department, that collaboration I think is really useful. I must say that our naturopaths have been really easy to work with, and they practice in a very systematic and targeted way. A generated problem list, a proposed targeted therapy, and follow-up. And that's been making it easy to understand what specific concerns or deficiencies are being proposed to be targeted, and I really appreciate that approach. So I do not, and I could not try to be a naturopath in my consult, but there is that information that support available within the Attune Health model that we can tap into. I certainly like to try and focus on the healthy lifestyle measures. As a general practice department, I don't want us to be paying lip service to lifestyle measures. I think that we're going to talk more about a lifestyle prescription and get into the details of educating that in detail and seeing that follow through as the foundation, and then the additional therapies on top of that, specialist therapies as we need to. But keep on reinforcing this target, because good sleep does make a difference, good breathing technique does make a difference, good diet does make a difference. And we see this in so many chronic diseases that we keep on having to make sure that the simple things are done well. Diabetes, an example, etc. I also think things like the breathing therapy is an exciting area which has great potential that's often overlooked. A lot of people will say, well, you breathe. Yes, you do breathe, but there is, functional breathing and there's disorganized or non-functional breathing. Again, this is not my specialty area, but I've got somebody within the Attune Health model where it is their specialty area. And so that's a resource that we can utilise and take advantage of moving forward, which I think is an exciting area. If you've got any further questions around any of these, please feel free to contact us, and feel free to email via reception. And I look forward to continuing to work with everybody at Attune. Thanks very much for your time.